in medical rounds, Hartford Hospital is the region's first Level 1 trauma center and is expanding in both clinical expertise as well as in research. Christa Green is a clinical research associate with the Injury Prevention Center at Hartford Hospital, and she's joining us tonight. Good evening, Christa. Nice to have you with us.
Thank you. Good evening.
Tell us about a Level 1 trauma center. I know Hartford Hospital, as I mentioned, is. What does that mean?
So being a Level 1 trauma center means that Hartford Hospital has met the highest standards for providing optimal care for the most severely injured patients. Our resources and services span across the trauma spectrum from prevention through rehabilitation.
So that means you're better able to save lives, and that's what we like to hear. Now, as a researcher at the Injury Prevention Center, which I did not know there was such a thing, which is great to know, what are you finding and how do you use this information to help the community?
So through our research, we know that our patients are most commonly injured from unintentional injuries. However, about 10% of our patient population are victims of violence. More specifically, we know that falls are the most common cause of injury, followed by motor vehicle and motorcycle crashes. So as a researcher, we use this information to focus and prioritize our prevention strategies in the community to help reduce these injuries.
And that's my next question. How do you get the word out? The end goal as a researcher, you want to prevent trauma and make sure the public is aware of the things that can get them in trouble in terms of trauma centers. How do you achieve this? How do you get your message out?
So at the Injury Prevention Center, we have 4 goals, and we achieve this through these goals. Clinical and community-based research, community outreach and education programs, policy advocacy work, and education and training of our clinical staff.
Good to hear. Now, your department works with gun clubs, talking about safety, and even the campaign Stop the Bleed. Tell us more about how this helps.
Yes, so we work directly with gun owners to prioritize firearm injury prevention. We educate them on safe storage practices and even recognizing signs that their loved ones may be suffering with suicidal thoughts. As for Stop the Bleed, this is a national campaign that educates and empowers people and gun owners on how to help a bleeding victim.
All right, well, you keep up the great work there, Christa. Thanks so much for sharing the information with us tonight. And if you at home would like to learn more, you can certainly call the number you see on the screen right now.